it. Whenever you're ready, Mr. Chair.
Good. All right. Well, welcome everybody. Lewis and Clark City County Health Board meeting. Believe it's May 22nd, 2025. I'm Vice Chair, stepping in for our wonderful chairperson who's out of town for the month. So we'll call the meeting to order. And if we can review the agenda. Are there any changes to the agenda? Not hearing any. We'll review the minutes from the April 24th meeting. Those are all in the packet. Does anybody have any changes or modifications? Not hearing or seeing any. We'll approve the minutes. We'll move to employee recognition.
Thanks, Mr. Chair. We postponed this from last month. Normally, this would have happened at the same time as new employee introductions. We try to do those at the same time. But we were delayed in making a selection because we had multiple nominations from staff. So what we normally do is every quarter, we take nominations internally within the health department, and it's a peer nomination. And essentially the application asks for what staff are doing that is really above and beyond what our day-to-day job is. So who's outperforming or overperforming, and who's doing really incredible work. We know that that's true of all of our staff, but there are times when we just have a staff that really does shine and stick out for the work that they're doing within the department. And we like to point that out and honor that individual, recognize that individual. And it's really fun to bring those award winners, quarterly award winners, to the board for you. So this past quarter, our selection was Janet, who is with us back here. So Janet is our administrative assistant who puts a lot of support into our environmental health team. Prior to that, she was the administrative assistant with our immunizations program, and she also supported our licensed establishment program. So she has a really nice breadth of understanding of our operations within the department. So when she moved over to serve the environmental health team, she helped to train Olivia, who is now supporting our immunizations team. And it continues to just be a really central part of that team to provide support across the entire department. Her attitude is whatever I can do to help. And so she really does go above and beyond to be a team player in the department. Sandy is her direct supervisor. So I'm going to pause there and let Sandy also say a few words, because she will be able to rave also about how incredible Janet is. And then she works directly with Beth and the environmental health folks. So I'm going to let her pitch in. And
Really gonna.
Yes, we're going to just slather it on nice and thick for Janet.
I am very fortunate that Janet is a part of the admin team. She is, just as Brenda said, how can I help? It doesn't matter what the project is. She's always someone that I can rely on. Even if I give her something that maybe is outside of her scope, she will grab that project and say, okay, I'll figure it out. I'll figure out how to make it work. She's always on time with the projects, delivers everything the way she's supposed to, and always smiles at everyone, even if they don't deserve the smile sometimes. She gives it to them. So yeah, she really is a joy and a rock solid foundation for all of public health. Beth? Yeah.
Janet loves this.
Yeah,
She loves this. absolutely adores this.
all this attention. No, yeah, Janet started working with us about a year ago and so grateful that it's been easy. She fits right in with our team and our sarcasm and how we operate, and she's fabulous. So I couldn't say enough. I always am just like, don't ever leave me. Don't ever leave me. She's definitely a huge help to me and our staffs.
There's a lot to track in environmental. There's permits that are coming and going. There's complaints that are coming and going. There's phone calls after phone call after phone call. And Janet just with a smile handles anything and everything that comes her way. So just wanted to say thank you so much for what you do in the health department and so deserving of this award.
Thanks.
Thank you.
Appreciate it.
Congratulations, yeah. A little comment?
She might throw things at us.
Great, thank you.
Most of our staff are very humble and have a hard time hearing nice things about them, but they deserve it.
Right. All right, moving on to action item, budget.
All right, so at our April meeting, I presented a preliminary budget to the board, just to give you a sense of where we were headed, where our priorities were needing to be. And so we did have a really great conversation, lots of good discussion, good questions last month. And so this is really just a follow-up to the preliminary. For those that are online, and may not have heard me say this a few minutes ago, but our budget in the packet is now outdated as of yesterday afternoon. And we had to make a correction to it. And so what Heather has up on the screen right now is current. And then those of you in the room, we had some printed out. So we can, we didn't get this emailed out. But we will do that as a follow-up so that board members can have it. But for now, we're gonna share share the screen and we'll just walk through the budget and we can answer questions as we go. And I'll point out, there was one significant change, and I'll make sure to point that out as we go. And you can even just mark that change in your old packet, just so you can kind of track as we're going where that happened. So we are going to start with the first page of the budget, which is the combined. And as a reminder, we break our budget into 3 sections. And that's because we have a very complex budget and we have varying revenue sources. And so our budget consists of our health mill, which is essentially funded by the local tax dollars. And then we have our grants, which is a second piece of our budget. And then the third piece is our water quality protection district. They have an assessment, which is assessed on properties that are within the district boundaries. And that funding has to go specifically to water quality protection district. So they have their own specific budget. So this first sheet, what it does is combine all 3 of those into one. And so the highlights here are essentially the overall public health revenue, which is in that very top line. We're looking at $6,415,074 for overall revenue for fiscal year 26. This revenue includes those, if you break it down, there's a variety of categories that represent our revenue. So again, we have taxes, we have licenses and permits, intergovernmental revenues represents our grants, the grant funding that comes through. Some of our services we're able to charge, and so those fees are represented there under the charges for services section. Fines. Miscellaneous income is going to represent income that we get from the county, essentially. So an example of that is going to be there are funds that the county receives that get to be used specifically to cover employee health insurance. And so it's a special pot of money specifically for employee health benefits. And so that revenue that comes into the health department to cover that expense is what we consider a miscellaneous income. And then Heather, you'll have to remind me what other financials are. Unless I misspoke and that was miscellaneous income. You're on mute.
Hold on 1 second. I just want to pull up another sheet so I don't miss.
Okay, okay. There's a handful of things that get lumped into these categories. And so I just want to take a second and show you what miscellaneous income is and what other financials are within our revenue categories.
So in the miscellaneous part, we have the miscellaneous revenue. We have so the large part of the miscellaneous income is actually representative of the water quality transfer from the county that they get. The other financials is where the health insurance credits will show up in.
Okay, I had those backwards.
Yeah.
So miscellaneous is going to be our water quality money. And then other financials is things like health insurance.
Yeah.
Thank you for correcting me. And then expenses, we're looking at $7,196,903 in overall expenses across all three sections of our budget. And our expenses in broad categories are essentially personnel services. We are planning for a 2.13% cost of living increase, which is represented in that personnel amount. Our operations and maintenance category is everything from printing to postage and office supplies and all the things that we need to operate. So training dollars and travel dollars and
Janitorial.
Yep, that's all
in there.
Janitorial is going to be a fixed expense because that's Public Works who take care of our building. But the details of operations, we'll get into those details and you'll see them in the next few pages. But it's all of the budget categories that essentially don't fit into personnel or fixed. Fixed charges are going to be rent, IT. These are the things that are set. These are the expenses that are set by other departments in the county, and we're just given the amount to put into our budget. And so all of our staff get a computer and they have access to the network. IT bills us for that amount. We pay IT for that service. We live in a county building, so therefore we pay Public Works for the maintenance of the building or rent. It's not really rent, it's really maintenance. It's a maintenance assessment on the building. So they take care of our janitorial services, any maintenance on the building, that's considered a fixed charge. And then other financing uses. There are certain grants that we are either subsidizing or there's a required match. And so I'll get into those details as we move through the sheets, but essentially the $465,000 that sits in that category, we are subsidizing by using our mill dollars to support other programs within the department.
And other finances also includes our CIP transfers to the Capital Improvement Fund.
Thank you. And as you can see, our expenses are greater than our revenue. But so is our ending cash balance. And so our projected ending cash balance at the end of fiscal year 25, it's projected at $1,308,640, which is not on your sheet because what's on your sheet is actual. So it's showing an ending cash balance of sorry, I'm using that number belongs to the mill, not the overall budget. I'll get into It's easier if I do it explain that in the mill instead of in this overall combined budget sheet. Essentially, our expenses are greater than our revenue, and we will have a cash balance in our mill and in our grants and in water quality to cover that negative, that shortfall, that negative. And I'll show you as we move through the sheets, I'll show you where that is.
And then you have to have a reserve too, is that true?
The reserve is 33% or 90 days. And it can't by law be more than that. But the 90 days does help. If an emergency happens and we need cash that on hand that we didn't plan for.
Mhm.
So that's essentially, I'm going to get into more details as we move through, because we're going to look at the mill specifically. We're going to look at grants specifically, and we're going to look at water quality specifically. This is just everything combined. So I'm going to get more into details now that any questions on the overall? Okay, so your next page is going to be our summary for the mill. So the summary it's in the same format. It's going to give us our overall revenues, our overall expenses, and then those broad categories. But in the next 1, 2, 3 pages after that, those are all your details. So this summary page does a nice job of kind of rolling up the details into those broader categories. So if you have specific questions that gets down into those details, we'll refer to the detail pages, but I'm going to focus most of my comments on this summary page. So just starting again at the top. So as a reminder, our mill portion of the budget, our revenue is primarily the taxes that are collected through the health mill. And the charges that we the charges that we get from services that we provide. That's the majority of the revenue that we get into the mill. And then our expenses are projected at $2,958,425. Again, our expenses are more than or greater than our revenue by $333,000. So if you look, I'm going to walk you through this and we'll try to stop me if it doesn't make sense. At the bottom of the columns, you're going to see ending cash balances for what we budgeted for fiscal year 25, which is the third column over, 1.3 million. So when we built the budget last year for fiscal year 25, we anticipated, or we projected that we would end the fiscal year 25 with $1.3 million. So that was our best guess based on the cash balance at the end of fiscal year 24, and then how we anticipated spending in fiscal year 25. So this was a best guess number, projected number. And then the $715,000 represents our actual as of like right now. So it doesn't account for the rest of the fiscal year. It's just what our cash balance is today.
It's as of the end of April.
This is probably as of yesterday because.
It's as of yesterday.
Yeah, because we pulled these brand new fresh reports yesterday. So as of yesterday, we had an ending cash balance of $715,000.
But excuse me, we're not counting the money that's coming in from taxes now, and that's
Correct.
the big thing.
Correct. That's the point I want to.
People pay out two installments.
Yes, yeah. So that's the point. That's the number you don't see on your sheet, is what we're projecting the ending cash balance to be at the end of fiscal year 25. Because we have several months left, we have a couple months left of this current fiscal year. We have more tax dollars coming in the month of May. So then that projected number for the end of fiscal year 25 is $1,308,640. That is $175 day reserve, which is way over where we're supposed to be. So I'm going to explain how we're going to correct that as we move through the expenses part of the mill budget. But that's what's being projected for our cash balance at the end of this current fiscal year. And so our expenses, as I said, are over the revenue. We have more expenses anticipated than revenue coming in. We will be using that cash balance to balance the budget, essentially.
And I think that this may should be one of the next pages, but have you got an anticipation of the extra income we can derive because of the change in the law on on some of the services that we perform?
Yes, so the licensed establishment fee update bill it did pass and the governor signed it, which means that those licensed establishment fees will be changed as of next. So they collect on a calendar year. So all of our operators or our licensed establishments will get a bill in October to pay their licenses for next year, the calendar year 2026. And the new updated fees will be reflected on that invoice that they get.
It's not on here.
But it is part of the revenue that we are projecting. Well, Heather, I don't think we used the updated. I think we used our current.
Our budget process, we did not have the actual confirmed yes, okay, that it was going to increase.
Yeah.
So our budget does not take that into
Reflect
account, and it would only take it into account for half of the year.
For half, So we will, next fiscal year, we'll have that corrected revenue. But essentially what we can plan on is about double. So right now we're getting between $50,000 and $60,000 in fees from the collection of license fees from our operators. And that will about double starting next year.
I had a quick question. You probably talked about it before, but it's based on number of employees, square foot of business. How are they? Assessing that?
There's multiple licenses. And so if we're talking about restaurants, it is going to be based on number of employees at their peak. And then it'll be broke down into small, medium, and large. And then they'll be assessed a fee based on their size. And their size is determined by how many employees they have. So we're collecting that information from our licensed establishments now, so that when they get their bill from us in October, that the bill will reflect what it is that they need to pay based on their size. So that's restaurants. Pools and spas, the biggest change that happened there is the pools and spas that are year round, they pay a little bit more than the pools that are just open in the summer, because we are required to do 2 inspections a year if they're a year round. Let's see. Another big change was our public accommodations. At this point, if you're a hotel and you serve food, you just need 1 license, which is a public accommodations license. With the changes, if you serve food and you're a hotel, you will have to have a food license and a public accommodations license. So that's another big change that we're going to help our businesses kind of plan for and work through between now and the end of the year. Because that's pretty significant for a handful of our public accommodations that they serve like a continental breakfast. And so in order to have a food license, you have to follow all of the food code. And so that's going to be a big change for some of them. Not all of them.
They haven't had to.
They haven't had to.
Oh, really?
Yeah. Yes. So it corrects that.
Yeah.
Because right now we have public accommodations that are serving food without having to follow the food code. So,
It's scary.
yeah, so, or have the proper kitchen equipment. So, and in some cases, it's prepackaged muffins. And so it's really not a big deal, but in some cases, it's much more than that. Our public accommodations that serve like a full-blown breakfast, eggs and bacon and hash browns and biscuits and gravy and waffles and all the things, they have a commercial kitchen. And so they already are following
Got it.
the food code. So
Okay, that makes sense.
it'll be a change for some, not a big deal for others. Our team will help our businesses through that change as we move towards next calendar year. It won't be a shock to them. By the time January 1st, 2026 comes around, our businesses will be ready to go. We'll help them through it between now and
I
then.
have one other question, if you don't mind.
Yep.
So I had a business that was a huge warehouse, but not too many employees, but we had 3 bathrooms. Do you count that? Do they inspect the bathrooms?
Not,
Or do
well,
you have a little kitchen in there?
so only if you're serving food to the public.
No.
So
Okay.
that's really the licensed establishments that we inspect or that we have any kind of regulatory function over are those that serve the public in some way.
Okay,
So
so-
a warehouse with some offices and bathrooms, we wouldn't have any. If it's in the county, you probably interacted with our environmental health team for septic and well type
Yeah, it
conversations.
was in the city.
but-
I was just curious.
Mhm. Yeah, but our licensed establishment team so it's going to be restaurants, pools and spas, public accommodations and campgrounds
Okay,
is who they inspect and who these fees specifically impact.
okay. Good information.
Daycares, yeah. Oh, daycares we don't license them though. Yeah,
But you don't get fees.
yeah, we don't get the fees from those. They're not a part of this fee package. And they can do education in lieu of inspection, daycares can, so. So, to circle back to your question, Commissioner Rolfe, the revenue does not accommodate for that change, but next fiscal year it will. It won't go into effect until January. So it wouldn't have impacted the full fiscal year anyway.
And I would think it would apply, which line would it be on the next slide, page there? Sure.
It would be, maybe Heather can help me. It's a revenue. And it would be,
Sorry, hold on. It is under. Oh my, where did it go? Oh, it would be under, the plan. Are you talking about the plan reviews, right, Brenda?
just all the licensed establishment fees,
So
that revenue.
Plan reviews and inspections are actually state revenue. That's where those go. And then small and large facilities and cottage food registrations, those are under licenses and permits.
But you think we'll pick up an extra, almost double what we have?
I'm estimating between $50,000 and $60,000 additional revenue starting next calendar year.
And currently those fees cover 40% of the costs? Is that taken
They cover 18% now.
for 18%? Okay.
So about 30.
Yeah, so-
Yeah.
Yeah, so it's still, it helped to balance the, how the program is funded a little. The program, for the most part, is funded through, our health mill. So property taxes that come into the health department to do our work pays for that program more than the fees do. It helped a little, and we're grateful for it. I'm not gonna complain a bit for increased revenue. So this is the time I'm gonna point out kind of the big change that occurred between what you saw in your packet in advance of the meeting today and then what you see in front of you today. So under expenses, the operations and maintenance for fiscal year 26, we're looking at over $1 million in operations and maintenance. That is a much larger number than what you saw in your packets. So the budget before it was corrected did not account it was a much lower number than that. So let me explain why we have an additional $500,000 added to our operations in the mill. So I'm going to set the stage by saying we know that we are losing at least one grant that is federal money into the health department. And we've known this all along because when we were given the money, we were told it's one-time money and not to expect it to continue on. The funds that we received was for our immunizations program, and it was a substantial amount of funds that we were given over 2 years. It was at almost $600,000 or probably over $600,000 that we were given. And we knew that that wasn't going to be sustained, or that funding wouldn't continue on. And so our immunizations program right now is essentially being funded by those dollars. So our 4 nurses that do the work for immunizations, they're able to do their work and provide the service utilizing those grant dollars. So that's what pays their salaries when they're doing any kind of immunization services. That's what pays for supplies. So we had this revenue and we're using it for the purpose that it was intended for. But as soon as those funds go away, that program will have to be entirely supported by the mill again. And so the extra funding that we have sitting there, because if you remember, the projected ending cash balance at the end of this fiscal year 25 is $1.3 million, which is 175 days of reserve. So we're taking $500,000 or just over $500,000 of that reserve, and we're putting it into operations and maintenance, anticipating essentially losing federal funding for this year and next year. So it's a little bit of a contingency approach, knowing that we know at least that funding will be going away. And then we are hearing such volatility at the federal level and other potential funding cuts that could happen. And so in anticipation of, we don't want to be caught flat-footed with other federal funding getting cut. So these funds we're adding them to our budget as a placeholder, as a way to say, we're going to do what we can to cover any losses from losing federal funding. And that's how we worked with Frank, with the county, to make that happen in our budget. And so that was the biggest change that you see in this budget versus the one that you saw in your packet. Is first of all, we can't have 175 days of cash reserve sitting there. And secondly, we are really concerned about what the decisions are being made at the federal government regarding our federal funding. So Shannon last month asked a really great question about how our funding breaks down. And Heather did a quick calculation for me for today. And I will tell you that 37% of our budget is federally funded. That's pretty significant. If we lost federal funding, it would be a really significant hit to how public health operates. We would lose staff, we would lose programs. And so this additional $570,000 that we have as a placeholder in our budget will help us survive any unknowns that might come our way this fiscal year. Does that help? I mean, it's not ideal, but that's the only way we could think to give ourselves a little stability in a really volatile situation, is to just kind of have a placeholder. So that's what that amount is. And if you look at, it's the 3rd page of the details. So we should have numbered the pages, but if you count 3 pages back into the details. That number is living if, under the expense category, other purchases and contracted services, so 3910. And I don't know, Heather, if you can outline or highlight that on the screen. But that total number is 672,000 in that last column. We do have contracted services in there, but the majority of the contracted services, 590,000 of those, that's going to be our placeholder. That's the amount of money that's sitting there waiting for federal funding to be cut so that we can cover some operations, continue to do our work, our important work in this fiscal year. Okay, so that's where that is in the budget.
If I might just.
Yeah.
You really have, I think you've done a great thing here in the way you set this up so that it's realistic.
Mhm.
And while all this stuff's going in DC, we don't really know where we're at.
We don't.
But one of the things that really confused me when I first got on the commission was looking at the funding anyway, because so many times we would get we would have federal grants that we were depending on,
Yeah.
but we didn't get the paperwork done on them until well into the year.
Yeah.
And
Yep.
it was really almost, it worked because the grants were always there, but it sure made it look bad at the because you felt like you were wishful budgeting,
Yes. Yeah, our grants portion of the budget, we do a little bit of that we budget in anticipation, but we don't always know quite sure what we're going to get because we don't know it at the time the budget's getting built. So we'll get into grants in a minute, but yeah, it's those types of complications that make it difficult to put a budget together.
Yeah.
And so what you see is our best understanding of the situation and our best projection of how revenue is going to come in and how we anticipate spending. So I wish that I could say it's perfect, but it is a budget and it's, there's some gray in there.
And I think you're to be commended for having put some money aside this last couple of years to fund your reserves so that, because you never know what's going to happen and what just happened.
Exactly.
Yeah.
Well, and I sure wish that we were allowed to have more than 33% of our 90-day reserve for these very reasons, because it would really be great to have more of a contingency setting there. But the law says we can't have more than 90 days. So that's what we're going to work with is what we can.
Well done.
The other thing that I'll point out before we move on from the mill is that the mill does subsidize 3 of our programs. So air quality is a federal, or it's a grant that we get from the Department of Environmental Quality, and we subsidize that program through the mill, $25,577. And then the licensed establishment program, which we've talked a lot about, the money that we get for that program is not enough. And so the mill subsidizes licensed establishment, and that's at $347,051. And then maternal child health block grant is also a federal grant that we get that requires a 75% match. So our mill supports that program, $48,316. And so you can find that those are, you can look at it in a couple places. So if you're just looking at the summary, expenses, other financing uses, that $450,000 in that last column is representative of those subsidized programs. And then the details are down in expenses on that last page. It's the same category name. So it's on the very bottom of that 3rd page, other financing uses, transfers to other funds is for the 420,000. Those are If you added those three numbers that I just gave you, it adds up to the 420,000. So we're using mill dollars to support those programs that they don't get adequate funding, but we need to fund them in whole in order to do the work. So the money comes from the mill to make that happen. And in the case of maternal child health, it's a requirement. So in order to get those block grant dollars to do maternal child health work, they require us to match it 75% in order to get those federal funds. So. And that's not new. We do that every year, but I wanted to point out that that's happening. And then our capital improvement plan is, if you are looking at that this third page of details down at the bottom, it says transfer to other fund CIP. We are contributing $30,000 from our budget into our capital improvement plan. And that is to cover planned
Obsolescence.
it is, so we have things in our capital improvement plan, we have like our vehicles. And so we plan to replacement is the word I was looking for. We plan to replace those vehicles. And in order to do that, we put a little bit of money into our CIP every year. And then when it's time to replace a vehicle, then we have the money there to do it. So the capital improvement plan, it's not in there to be used for just anything. It has to be used for the things that we're saving for. The majority of our capital improvement plan is our vehicles. We have 7 vehicles in the health department and they have to be replaced periodically. And so that's how we save to replace them when it's time to replace them. Our huge copier, it was a $15,000 purchase. We had also saved in our capital improvement plan to this fiscal year replace that big monster copier. So it's things like that you see in our capital improvement plan. So on that line item, you can see where we're contributing from our budget into the capital improvement plan, $30,000.
You'd be amazed at how few local governments have a capital improvement plan.
Oh, I don't know how they do business.
It's absolutely scary.
Yeah.
This is one of the very few in the state. They're trying to educate people to do it more and more.
Yeah.
That's why Nancy Everson went to work for for Mako, because to try to teach them how to use it.
Yeah. Yeah.
But it was when she told me that when they transferred to that pre-planned capital spending, that it was a battle like you couldn't believe for the first 3 years. But once everybody got on it, they love it.
Yeah.
So
I know that we're not supposed to call it a savings account because it doesn't function that way, but that's how I think about it. We are saving to replace things that we need to replace. Yeah. And Public Works is another department in the county who maintains this building. It's very important that they also have this really nice, robust capital improvement plan. They replaced did a roof repair on this building just this year with money that they had put aside in the capital improvement plan to do a maintenance, needed maintenance to this building. So that's another example. That doesn't come out of our specific budget. But the money that we pay every year for rent helps to cover those that ongoing maintenance of the building. So, okay.
very good.
That is essentially what I wanted to highlight for you in the mill portion of the budget. Any questions on the mill?
I just had a question about titers. I saw that in here somewhere.
Yeah.
How often do you get requests for that?
Fairly regularly. And I would say that with measles, in the situation with measles, there's more now than ever because a titer is what's used to show immunity when somebody doesn't have their vaccine record. So we do the best we can to kind of anticipate how many we would do every year, but it varies. Heather might be able to dig into the back end of the finance system and give you an idea of, or she might even be able to show you. You can see on the budget, like how much we've brought in revenue related to titers. But how that equates to numbers of titers, I couldn't do that calculation. I'd have to have
Mhm.
Shelley do that for me and then get back to you. But you can kind of get a sense of under the actual category, like
Mhm.
what we've brought in for
Mhm.
titers.
Yeah. That's smart to do that rather than just vaccinate.
Yes, yeah. If somebody was exposed as a child because they lived during the time when measles was more prevalent, or they were vaccinated as a child and they don't have their vaccine record, it's easy to do a blood draw to show immunity.
Where is it tested?
We utilize the state lab for all of ours.
Oh, really?
Yeah, yeah, they're the most effective for us to
Okay.
use. Yeah. St. Pete's, I think, they have their own lab internally
Mm.
and then probably contracted lab,
Mhm.
but
Yeah, ours are getting sent out, I think.
Yeah.
I was trying to think, I just had one. I didn't look to see where it went, but
Yeah.
Can anybody use the state lab or does it have to be,
it-
Department of Health or whatever?
I think that if you have a contract with like St. Pete's could use a state lab if they had a contract with them.
Mm.
Yeah, it's available to any provider that wants to,
Okay.
yeah. To the best of their capacity anyway. I wish that our state lab was double the size
Does
to
it take a while?
take on more.
It'll take a while.
It does take a while. And and this is kind of an aside, but I'll say it anyway. They received some federal dollars to do construction on the state lab and expand it and get new equipment. And those funds were taken away. So they started a construction project and started to order equipment, and then they had to stop because the funds got taken away. So they were in the process of doing a full modernization of our state lab, and then they're not going to be able to do
Wow.
it. So,
Hmm.
yeah, really unfortunate.
Hmm.
Okay. That's it for the mill. We can move on to grants then as the next section of our budget. These next two sections shouldn't be quite as complicated. I think the mill was the most complicated piece. So we'll start with the grant summary. We are anticipating $3,374,000 in grant revenue for this coming fiscal year. And we're expecting $3,753,226 in expenses. So again, we have more expenses than revenue. And then I'll just point out that we do have cash reserves in our grants that will be used to balance the budget. So that amount is listed under ending cash balance. And our actual, as of today, or as of yesterday, cash balance for grants is 987,000. So there's plenty of grant money sitting there waiting to be used, and 379 of that cash balance will be used to balance the budget for our grant.
Where's the 379 at?
So under our the very last
There it is,
column.
right there.
Yeah, that's the negative amount. So more expense than revenue
Mhm.
is the 379,000.
Okay.
And that amount will be covered by our ending cash balance from this fiscal year. And then as far as grants are concerned, let me refer to my notes. We anticipate, trying to find my number. I should have highlighted it. The grants are reflecting 20 different grants that we are receiving. And that's an increase of 2 grants from this current fiscal year. So this year we have 18 grants. Next year we are planning for 20 grants. I wasn't going to go into any other detail on the grant budget unless you have questions. There's nothing else that is out of the ordinary when it comes to either revenue or expenses. I'll just say again, and I said it just a minute ago, that when it comes to grant revenue, sometimes we know the exact amount that we'll be receiving, and sometimes we don't know the exact amount. And so we're anticipating a number, and typically we use the current year's number. So we get, there are grants that we get every year, and sometimes that amount changes and most of the time it doesn't.
Hmm.
So if the state hasn't given us an amount, we use the revenue that we got from them this year as the revenue that we expect to get from them next year. Unless they've specifically said, you're gonna get more or you're gonna get less. So the budget reflects, to the best of our knowledge at this time, this is the grant revenue we are expecting for fiscal year 26. And again, I'll just say it again, that 37% of our budget is funded through federal grants. 8% of our budget is funded through state grants. And that state revenue that we get is usually special revenue. There's zero general fund dollars that support public health in the state of Montana. And then 55% of our budget is funded by local dollars. So those are our tax dollars and our assessments and our fees for service.
I have a question.
Yes, sir.
Brenda, do you know, sorry, and you might have clarified this and I missed it. As far as state versus federal grant funding, do you consider if the state agency is a pass-through organization of federal funding to local, like, is that considered federal funding or state funding?
That is counted as federal funding.
Okay.
Yep. So we accounted for all of the federal funding, even if it gets passed through the state.
Okay.
And we get both in the health department. We get direct federal funding through a couple of grants, but a lot of our federal funding is it passes through the state. So the state gets it and then they give it to us. The maternal child health block grant is a good example of it's federal dollars. They give it to the state. The state then breaks it into 56 different amounts. Each county gets a little. And so, but we account for that as federal money. Yeah.
Thank you.
And it's required per audit that we account for that as federal money.
Brenda, can I just say something?
Yeah.
I think it's also really good to know that a majority of the federal funding that the state gets and passes on never loses its federal identifier. So it stays federal even to local agencies, even though the state receives it. So.
Yeah. Which allows us to account for it as federal money. All right. So if there are no questions about the grant section of the budget, then the final section is our water quality protection district. And I'm just going to focus again on that summary page. So for our water quality protection district, they are funded through a fee assessment to properties that live within the water quality protection district boundaries. So it's not all residents in the county, it's just within the district boundaries. And their revenue is projected to be a total of $416,226 this year.
Can I ask a question about that?
Yes, ma'am.
So the water quality assessment district takes into account, why is it a district? Like, it doesn't follow the county lines?
It doesn't. And it's because of the specific work that they're charged to do. The original district was set up to have a specific boundary, which is why only the properties are assessed there.
Is it a water flow, underground water flow or something?
It represents where the greatest population is. So the district boundaries are, let me see if I can get this right. So you can go south as far as our county boundary. So before you get to Jefferson County, the district boundary goes all the way south to the end of the county boundary. And then west, it's going to go as not quite as far as the McDonald Pass. So just to the side of McDonald Pass is where the boundary is there. The north boundary is going to be just past Lincoln Road. And then the east boundary is going to be just around the Spokane Bench area.
Interesting.
Yeah, and they have the ability, if they want to or see the need, so they are very data-driven program within the health department. So if they see a need based on the data to expand those boundaries, they have to go to the voters and the commission would have to approve expansion of those boundaries. But when the district was originally set up, it was set up to look at water quality and water quantity just within that area where there's the majority of people are living in the county.
So I fall in that category, my house, so I
Mhm.
would have an assessment on my taxes.
You
for that,
do,
But somebody in the North Hills wouldn't,
Not past,
not past.
not past, yeah, it is, what is that subdivision out there?
Actually, it's a little farther up, more, you want to kind of, as you're going up the interstate, kind of up the North Hill. But there's a section of definitely that whole North Hills is in the water quality protection
I was
district.
gonna say, because that's pretty populated.
That
up
area there.
Yeah.
But I
North
don't know the
Star?
exact boundary. What?
Yeah, North, that,
Probably, yeah, a little beyond North Star subdivision or that area.
yeah, okay, thank you for that
Yeah.
correction.
Yeah.
They have had conversations about expanding the boundaries, especially east. So there's need for water quality protection district work beyond where that east boundary is. But they are not funded to do any work outside of the district boundary. And so they've had conversations, the board and staff looking at the possibility of potentially expanding.
Mhm.
If they expanded the boundary, it would expand their revenue, but it would also expand the amount of work that they're required to do. So they have to be really thoughtful about, how much capacity and what the need is. If the need is great enough, then it would be worth going through the process. But it's pretty lengthy and involved process where the public that live in the area where it's expected to expand, they would have the say on whether they would have the ability to accept or reject that boundary. So it really does come down to the people who live in that area.
Interesting, because it doesn't encompass Canyon Ferry Lake.
Nope,
Yeah.
doesn't go that far.
And there's all those people that live around it.
And water quality considerations for everybody. Yeah.
Yeah.
There's a lot of septic systems out on the edge of that lake, so that we have water quality considerations there as well. Not just septic, but that's one piece, that's one element that contributes to water quality out there.
Yeah.
That we are concerned about.
We did a tour of Flathead Lake on their water quality that they do on that lake. It's extensive.
Yeah. Yeah.
And they can they know right away where something's coming from a sewage system.
Yeah.
And they can get it shut
Doing some
down.
really cool stuff up there.
Yeah, they do.
Mhm.
Yeah,
Yeah.
they really do. So, that surprises me. Kind of.
Yeah.
We used to have a cabin in Canyon Ferry. Lake,
Yes.
so.
Okay. For the expenses for the Water Quality Protection District, they're anticipating $485,252 in total expenses. Same categories of expenses. We're looking at personnel, operation and maintenance, fixed expenses, and then the financing uses, that $15,000, that's their capital improvement fund contribution for the year. And so you'll see that we have more expenses than revenue at $69,000 negative. And then you can see if you look at their cash reserve or the ending cash balance right now for fiscal year 25, they're at $238,000 of ending cash. So they'll be using their ending cash to balance their budget. They are over the 30-day reserve limitation, but the district is not bound to the law. Like the health department's budget, the mill budget is bound to that 33% or 90-day reserve. The district isn't bound to that same, but it's good practice. And so we try to keep the district budget at that 90-day reserve as well, and they're over it. So they'll be using their extra to account for the extra expenses that they're planning for in the next fiscal year. So unless you have questions about the detail for water quality, I'll stop there. And then if you don't have any questions about the budget at large, this is an action item. The board would need to make recommendation to the county commission for budget approval. So what happens after the board looks at it and recommends for approval, I take it before county commission. That's scheduled next Thursday. So the county commission will hear this budget presentation next Thursday, and they will make the final decision and approval of the budget. So today the board is recommending for approval.
Do we have any further questions for Brenda?
I think I'm supposed to abstain, aren't I?
Yes, sir. You have a final vote. So
Yeah. I'm not supposed to vote twice.
yeah.
Do we have a motion to recommend the budget to the county commissioner?
I
as
moved,
presented?
I move
I'll
to,
Great, we have a first and a second. Do we have any public comment? Doesn't look like it. Great. Not seeing or hearing any additional public comment. All those in favor in recommending the budget as presented today to the county commissioners, please say aye.
I,
I,
Are there any opposed?
And if you record me as abstaining, I'd appreciate it.
Yeah, and Commissioner Rolfe
And
abstaining.
I'm aye.
You're abstaining?
No.
Oh, aye.
Aye.
Yep, okay,
Yeah.
thank you. Great. All right, we'll send it off to next Thursday.
Good job explaining
Yeah,
And-
thank
everything.
you.
and yeah, may I, Mr. Chair?
Yes, go ahead.
I just wanted to take the opportunity to thank Drenda and Heather and the team. I mean, the way Drenda presented this information both last meeting and this meeting, I think the updates that were presented today, just everything, it's very clear the deep level of knowledge and expertise that Drenda and the staff of the department have in building this budget. You know, like public budgeting is a monster in and of itself. But the kind of industry knowledge, the institutional knowledge of the health department and of the county, it's really made voting yes incredibly easy. I have such confidence in making this recommendation to the commission, and I just wanted to thank Drenda, Heather, and the rest of the team for all of their work. This is obviously one of the most important aspects of it. It was made incredibly easy by the work that staff did. So thank you.
Thank you for your comments.
Thanks, Shannon.
Thanks. All right, moving along here, we've got the annual review of the strategic plan.
Right. And I'll just, before we get started with the update or the annual review of the strategic plan, connect it back to your board functions. And essentially this falls under the category of policy development. So it's 2 years ago, the Board of Health really set the direction for the strategic plan and set the 5 strategic initiatives. And so that is the role and responsibility of the Board of Health is to set forth the work of the health department. And the board did that 2 years ago as they outlined those 5 strategic initiatives. And so what you're going to hear today are updates on the work that have been happening in those 5 areas. So initiative number 1 is all about health equity and social determinants of health. The second initiative is behavioral health. The third is health across the lifespan. The fourth is environmental health and emergency preparedness. And then the 5th initiative is all about our internal infrastructure and making sure that we have the necessary resources and so forth that we need, the infrastructure we need to do the work of the health department. And so in your packet, this is the robust report that we pull out of the system that we use to track the progress. The presentation slides that we are going to give to you today are just a couple of the highlights. So what we did was we pulled the highlights that we thought were the most important to share with you today. But I gave you the full report in your packet. So you have it all, but you're only going to get some of our best highlights today. And the highlights that we're going to give you reflect the work that has happened over this past year. So we're at the end of the second year of our 3-year strategic plan. And so the updates will reflect work that's from April of 2024 through April of 2025. And I'll give Sandy just a second to will you share or do the presentation? Yeah. The slideshow.
It is.
Down in the right-hand corner by the zooming. It looks like that's the show her what little button.
It's like a little screen.
Yeah, it's a little screen. Yeah.
Sorry, on your screen.
It is very tiny. I'm like, okay, wait a minute. I'm trying to figure out which one.
Okay.
Okay, there we are.
And it looked like you shared just fine, but I'm going to pause and make sure everybody online can see the slides. Is that true? And we can't see you anymore, so somebody will have to say it.
We can, Dorinda. We can see it.
Okay, perfect. Yeah, the screen has now been taken up by the slides. So if you give us facial expressions as we walk through this PowerPoint presentation, we won't get to see them. So you'll have to speak up if you have questions or with, gestures. So we have today staff within the health department that are going to help to present these highlights. So Beth is with us from environmental health. She has a smattering of updates to give throughout the presentation. Mary is our family child health supervisor, and there's quite a bit that she will be giving an update on. And then Julie is our prevention program supervisor, and will also be giving you lots of highlights. You'll hear from me periodically throughout because we're missing a couple supervisors. So when we get to the point where we're talking about immunizations and that program, Shelley's not here, so you get to listen to me talk about her stuff. So there's a couple places where I'll jump in and be helpful. But we'll go ahead and get started. And the first initiative is all about health equity. So the goals in this initiative essentially are improving the knowledge of health equity and social determinants of health, and building capacity within the health department to integrate into our existing programs. And then also enhancing access to public health services by addressing any barriers that we identify and reducing disparities in the community. So lots of successes and lots of updates. So I'm going to let Julie get started and then I'll jump in.
So there was a great article in October about the Sarah Sandow's work on disability accessibility. We can send it around if you like. I think the rest of this is back to you.
Yeah, I guess I could have done that for you. We didn't practice, so we're gonna we'll do a little herky jerky once in a while. And Amber's not here, or else she would be giving you lots of highlights and updates on the communications work that she's been doing over this year. And so social determinants of health and health equity has been really well integrated into all of our communications out to the public. Our newspaper columns, social media posts, anything regarding WIC or sexually transmitted infections, substance misuse prevention, immunizations, that's all had a really strong health equity message. Essentially what we're saying is we want our messages to reach everyone. That's when we say health equity, that's essentially what we mean, is we want to make sure that everybody in our county is getting the information that we have to offer. We additionally hosted the screening of Invisible Shield, which both Commissioner Rolfe and Sherry participated or attended. There were 4 sessions of the docu-series that was put out by PBS, and great participation by folks in the community. We didn't reach quite the audience that we were hoping to, but the Invisible Shield documentary itself was produced with a real health equity lens. So that's why we added it here. And then our Behavioral Health Local Advisory Council, Health Departments has representation and sits on that council. It's a community coalition. And they really worked hard over the course of the legislative session to engage community members who had benefited from Medicaid expansion and encourage them to advocate for the reauthorization of Medicaid, which occurred during the legislative session. So that's a huge success.
So I'll jump back in. This is Julie. We had a staff member working on, so out of the 2022 Community Health Improvement Plan, what we wanted to do about chronic disease turned into a social determinant of health accelerator plan. And then one of those items, it's all nested into each other. One of those items was a training list about cultural competency trainings, as well as a food resource directory in terms of food banks and other organizations, and that'll be posted on our website. Our tobacco education coordinator did some really great presentations at the middle schools and reached almost 700 students over a couple days. And then she also started a recycling program going around to the schools to pick up confiscated vapes. So that's been a service to the schools and also helped her make some really great inroads with the school resource officers, principals, and
then our public health emergency preparedness program, we've had staff recently trained. They went down to Texas, San Antonio in the last month to learn how there was a lot of things that they learned, but one of the big takeaways that they brought back recently was the need to understand how to make sure those with special needs are cared for during an emergency. So one of the examples used when they were at the training was all the fires in California and individuals that didn't survive because they had disabilities and nobody was there to help them. And so in our community, we want to make sure that our neighbors know who within their neighborhood could potentially need additional assistance and make sure that they are connected with help in case of emergency. And so they brought back a lot of really great ideas. And in this next year, we're going to see some work happen in that area. We did quite a bit of work around alcohol education campaign, and there was a lot of good health equity language incorporated into all of that alcohol education. And then our WIC clinics, they started back up again in both Townsend and White Sulphur Springs. So reaching out to our most rural residents, even outside of our county, so serving our neighboring counties as well. So as you can see, and I alluded to this already, that in the next 6 months and over the next year, we're going to be looking really seriously at how the health department can play a significant role in helping our community understand where those functional needs exist in our community and developing a plan to ensure that they are cared for during emergency. All right. And that's also going to be our quality improvement project. We see an opportunity for doing that better. And so that's what we anticipate. And then throughout our highlights, you're going to see specific call outs for health equity. And this whole initiative is about health equity. So we just refer back to our successes. All right. So initiative 2 is behavioral health. So we're looking at increasing staff capacity, knowledge, awareness, and understanding of behavioral health and the role that we can play in the health department around behavioral health, strengthening and expanding partnerships, and then prioritizing our staff wellness and resiliency. That really came, if you think 3 years or 2 years ago when this was built, we were still trying to recover out of the COVID operations, and having prioritizing staff resiliency was really important to us at that time. So that's what that's about.
Excuse me, Brenda.
Yes.
It doesn't appear that the slides are advancing on their side. Lisa is mentioning that she's not seeing anything change.
Okay.
Can we hear from anyone else? Are you seeing the slides advance?
So it's probably because, well, I'm not sure.
They're not advancing.
Okay.
They're not advancing.
So escape out of this mode. Yeah, hit your escape button on your keyboard.
That doesn't work.
Oh. Stop share.
All right, let's try this.
And we could use, I mean, we can just stay on,
Stay there.
yeah. So try to share again.
Okay. And then
Yeah, and we'll just use this instead of putting it into presentation mode. Let's just stay here
okay.
because that might be what's causing the issue.
Okay.
Okay. Are you all seeing initiative number 2, behavioral health?
Yes.
Okay, we'll just stay here then. And then it might be helpful, Sandy, that you can actually make that column on the left or the slides on the left, you can squeeze that smaller and make the, yeah. So there, we'll just do it that way.
Okay. I'm gonna get up here so I can see what slide I'm at. Okay.
All right.
Sorry, we interrupted that.
That's it. Oh,
Are we ready?
thanks for pointing that out. We were just rolling like everything was great. Yeah.
No worries.
All right. So successes to share for initiative number 2. We have an effort within the health department to make public health personal. And so there's our internal wellness program that really encourages staff to take breaks throughout the day. We gather periodically to learn together about different wellness techniques. We have an expert within the health department that does Tai Chi. And so she takes 15 minutes a week to just show our staff how to utilize Tai Chi as a mechanism for reducing stress. Those are a couple of examples for our in-house wellness program. Oh, cool.
That's okay.
I was just skipping over you.
Okay, so Brenda already mentioned the alcohol awareness campaign, which we're in the middle of phase 2 right now, which include putting a plug, which includes the concert on the Walking Mall tonight. With the artist Superman, who speaks about substance-free living. I think I talked about these coalitions on the next slide. I'm going to skip a little bit. We are working on the development of the Journey Home Crisis Facility. So we're leading the development of the coalition with Many Rivers Whole Health, and the last I've heard is they are hoping to open in July. So that is very good news. We're continuing to do staff training on mental health topics. So we just had adverse childhood experiences, the presentation on that at the all staff in this month. We continue to do STAR-T training and QPR, which is question, persuade, refer, which is the suicide prevention training that continues to be offered to new staff and catching up anyone who could use that training again. And this was back in last summer. The New York Times featured a really powerful article about the LOST team, which is our local outreach to suicide survivor volunteer program. But we have distributed over 600 Narcan boxes, and we'll be doing lots more this year as well. We merged 2 coalitions. There was a local opioid overdose prevention coalition and then a broader local substance misuse coalition. Those 2 have merged and they're rebranded as the Strong Roots Coalition and recently have a new logo. We continue to work on supporting the mobile crisis response team out of St. Peter's with that community coalition. And then staff had the opportunity to visit Portland, Maine, which is the best practice site recommended by our grant officer about learning about mobile crisis response team programming. And there's a picture of ours on the next slide of the St. Peter's one, but I'll let Mary talk about mental health.
Oh, sure. This year we were able to start our universal home visiting program. And it has had a little bit of a rough start, but now we have Haley, who I think you met last month, in place, and she has built that relationship with the Women and Children's Unit at St. Peter's, and she is enrolling people left and right now. So it's very exciting. That program also really has a focus on postpartum depression, screening for that, and connecting people to resources in their community.
Photo of our local mobile crisis response team. I believe that's Jaden from St. Peter's. Plan for the next 6 months. So last night we had, the first, public event of our, let's call our Sober to Light, part of our alcohol education campaign. Another event tonight. We have a one-day summit that we're offering, a free summit for any, case managers, care managers, providers working on connecting their clients and patients to resources related to substance use. That's coming up on June 18th. And then, I'm not as familiar with this one. We are partnering with Food Share, with PureView, our mobile clinic, and the Caravan. Food Share doing 2 events coming up in the summer and late summer. One focused on kids and one for adults. The first one's the kid one. And then we're developing our overdose spike response plan for the county. So what that is when we learn about, the standard we've set is, the metric we set is if there are 3 overdose deaths in 24 hours in Lewis and Clark County, this will trigger the spike response plan, which is the name for how we're going to go about alerting what agencies and the public and how to do that. And that will be in partnership with St. Peter's and other agencies as well. And that will be a living plan with informal QI while it's being implemented to make sure it's running the way we want it to. And so PureView is using our mobile van, which is right now in Kalispell getting refurbished. That's through a federal grant to do outreach in rural areas. They have given out 15 Narcan, 22 fentanyl test strips, 5 gun locks, 8 deterra kits, and served 42 individuals and provided education to 116 individuals. So they've been doing a lot of work.
All right. So the next initiative is very robust. We have strategies that help to improve health across the lifespan. So we're looking at identifying aging issues and advancing collaborative initiatives around aging issues in our community, incorporating evidence-based practices for reducing adverse childhood experiences, adopting practices to improve nutrition and physical activity, preventing and improving the management of chronic disease, leading community efforts to reinvigorate our immunizations and STD programs, rebuilding community and individual level social connectedness and cohesion, and then protecting young children from lifelong impacts of lead exposure. And so this is a pretty robust section with lots of really great successes. So it has multiple pages of updates for you. I'll start, I'm going to put Shelley's hat on because she's not here today. She's on vacation, spending time with her grandbaby. So in the immunizations program, they've seen some significant increases in rapid testing. And this is because they've been able to get out and partner across the community and do a lot of outreach events. And so the rapid testing is HIV, syphilis, and Hep C. There's a slide on, there's a chart on the next slide that we can look at after I give you all the highlights here. The collaboration continues with WIC to make sure that parents with young children or pregnant women that are coming through the WIC office are offered syphilis rapid testing. That was in response to that really significant spike in syphilis that we saw over the last couple of years. So just working to find ways to reach more folks and get them tested and get them connected to treatment as fast as possible. Working in partnership across the community. So PureView is one of our greatest partners, the Caring Foundation, and just partnering on lots of outreach events. Let's see. Extensive medical provider outreach during measles preparedness. So as you all heard, there's another case in the state up in Kalispell. So it's just it's not if but when. So we are prepared. Our team has been connecting with medical providers. We're ready, essentially. And then we published a 4-part argument for vaccinations, and that's available on our website. And then there's been a lot of promotion of childhood vaccinations over this last year. And then here is the STD, STI testing last year compared to this year. So 2024, we had 97 total. And then so far this year in 2025, so we're not even halfway through the year, we're already at 165. So a lot of really great testing happening.
All right, Beth Norberg in environmental health. So this is primarily focusing on lead education and assistance. We not only work within East Helena, but with all of those in Clark County. We have a local lead coalition, and we've been having those every quarter, and it's been a really great opportunity for us to get together as a group and talk about that. We continue to do homebuyer education classes. So we do the RMDC first time homebuyer courses and talk to them about what to look for lead in their home. We have our 2 lead care testing machines, which I'm going to test a family here in a little bit, capillary blood lead tests we're doing in our office in East Helena for children 15 years and younger. And we have regular testing dates and times in East Helena. We also developed referrals. So if you're a resident in East Helena in the Superfund boundary, you can refer directly to St. Peter's Wellness and get a blood lead test for you and your family, free of charge, covered under the Superfund program. And then WIC, home visiting, environmental immunizations, we're all trained in how to do capillary blood lead testing, and that's a quick test. And then we've been working with WIC a lot in working with Head Start and Early Head Start and doing blood lead testing and just lead poisoning prevention efforts there. We've been doing parent-teacher conferences in East Helena elementary schools and middle schools, talking to a lot of people there. Also partnering with EPA because they're going to be going in and doing another round of yard cleanups here soon. And so we're partnering with them on that. And then every year we do the Purity Back to School event, of course, with the rest of the health department as well, to promote blood lead testing, the Christmas stroll, and continue to do environmental assessments. We have 2 actually that we're doing tomorrow. So that's if we have an elevated blood lead, we offer to go into that person's environment and look for the source of lead exposure and remove it from their environment, hopefully. And of course, we have our full-time LEAP staff now. I was just thinking today how wonderful it's been. And that is Steve Tennis. Okay. Talk really fast, sorry.
Okay, WIC and home visiting. So as we mentioned before, we were able to restart the WIC satellite clinics in Mar and Broadwater counties. They were going before COVID, and they obviously had to stop for a while. So now Dawn, who is our clinic coordinator, goes to Broadwater County every month and to Mar County every quarter. And that way people can have in-person visits in their county if they want to, rather than having to come in to Helena. I updated this a little bit, but I don't think it's saved right. So I'm gonna update the update. We did get a training seat for demonstrating proper car seat installations. I think that was a little more than a year ago. And so last summer, we were really able to do at least 11 events where our home visiting staff are trained car seat technicians, and they can demonstrate proper car seat installations on the training seat. It's this giant monstrosity that they lug around, but it's really handy because you can really see how and why it's so important to have your car seat installed properly. We have now been able to train all 4 of our home visitors as car seat technicians. And we did a little collaboration with St. Peter's. They helped pay for one of my home visitors to go to the training in Billings it's a week-long training. They helped pay for that. And in return, our staff is conducting car seat safety classes in conjunction with St. Pete's parenting classes. So that's a nice little give and take. Did I go through everything? Can you go back?
Oh, yeah, I'm sorry.
I'm not sure. I might have said everything. As I mentioned, we started Grow Together, which is what we call our universal home visiting program. Unfortunately, the federal funding for that is ending at the end of December. So we are actively looking for new grants. It's really tough on me right now. I feel really strongly about that program. So we are hoping we can figure out how to keep that going. Let's see. Yeah, I think that's it. I think I mentioned everything else. Thank you. Yep. Thanks, Cindy.
Kind of joined, we've created a map with outreach events for my team, Mary's team, and Shelley's team, the nurses, all people to sign up for outreach events, because coordinating that has been a challenge, and could be in the QI section as well.
Yeah.
And then there's quite a bit of East Helena work coming up.
Yeah, a lot of East Helena work coming up. We're just really increasing our outreach efforts. We're calling it the Mulch Project. We're actually figuring out ways to bridge the gap between yard remediation. So if someone has a really dusty, dirty yard and they have really high lead levels, can we do something, a quick fix until their yard is replaced, like mulch? We're doing boot brushes, mud mats, those kinds of things as well. And so we're partnering with Power Townsend right now to try to get some of those materials. And then we're just going to keep collaborating. Luckily, we have an ex-principal of Helena High. He is our in with the schools, and he's been awesome to get in there and be able to promote blood lead testing and lead awareness. And then we're just going to keep working with the EPA. They're going to be doing their part on cleanup. We're going to be doing our part on outreach and making sure that everybody's protected during the next round of cleanup. And we have a soils permitting program, and the parts feels a little clunky. So we're going to work through some of our soils permitting through a quality improvement project and see if we can improve some of those methods.
A lot of what the immunizations program is doing is trying to reach people, especially where they live or where they are, and getting out of the populated areas into the more rural parts of our county, and really trying to just reach as many people as we can with immunizations information and testing information. We continue to use our language link, which is it's a phone number that we call when we need translation services. So we have a variety of individuals who come into the health department looking for service that don't speak English. So we are able to use our language link service to better communicate with individuals who come in for service.
And the reason we purchased our lead care testing machines was so that we can be more mobile. For instance, in June, we're going to go to Early Head Start and Head Start. We're going to go to them and we're going to try to test children. We're also going to East Helena with our machines and trying to make it just better than having to go through a provider and do all of those things. If we can get that capillary test and then refer them appropriately, that would be the easiest way to break down that barrier.
All right, so that takes us to the end of Initiative 3, and we'll move into Initiative 4, which is all about healthy environments. So we're talking about climate change, protecting water quality, and then also building capacity around public health emergencies. And so Beth, just give me if there's any public health emergency stuff in there. Otherwise, it's pretty much all you.
All right, perfect. Well, I'm going to move away from the heavy stuff. Lead. Aren't I just so clever? Anyway, so we have a very strong relationship with our water quality protection district, the sanitarians and environmental health and water quality. So we continue to meet every 2 weeks. We're working on ways to share water quality results that we get and then give to the water quality district so they can map that. We're identified 3 outreach events for the next quarter. So we're working with realtors. We're doing a homeowner workshop next month for well and septic. So those are kind of just continuing to do those things. We have our DEQ grant. We're working through contracting right now with our septic system inventory for Lewis and Clark County. So we're really excited to be mapping septic systems, inventorying them, figuring out age and type and all these kind of robust features of it. But we're working through that right now, but very excited for that. And that will help us make future policy decisions around our wastewater regulations and things we should be doing there. We did update our wastewater regs, as you all can remember, on the Board of Health. We had a lot of engagement in our legislative session this year, did not anticipate it, but as bills are introduced, you go, oh, that's me. So that was great though. We had some really great successes, had built some relationships with legislators. It was actually a really great session in my world, maybe not other people, but in mine it was good. And then we have been we participated quite a bit this last year with emergency preparedness. So we had a lot of staff doing updated ICS trainings, but also we did tabletops for flood. We did tabletops for a wind event. Jay participated, I believe, in a air quality, the ConocoPhillips tabletop for like an oil petroleum leak. So that was been really good this last year. And yeah, so.
And we also did a tabletop for highly infectious disease.
Okay.
They just kept saying highly infectious disease. We kept calling it a measles tabletop. So that happened sometime last year as well. And then just another plug for our emergency preparedness program, really looking at how we can better serve people with special needs with emergency planning.
Oh, and then the water quality district, I'm Jennifer, I'm putting Jennifer's hat on right now, but they have a continual presence with Emerald Ridge. They did do a presentation to their HOA in January. There are some water availability issues in that subdivision. And so they've really been going out and working with the homeowners in that area, talking about things like water conservation and everything they need to do to continue their water availability. They had a water quality day at the Rotunda, and that's something they do every year. And it's always a really great event to connect with our local legislators. And they attended the Montana Youth Elders, and I don't remember exactly what that event was. Do you know, Brenda? I don't remember.
I don't remember the details other than it was an opportunity to be in a room with both young people and older people, talking and working with them on the idea.
Kind of legacy water quality stuff. Mm-hmm. Okay. Jennifer's probably like, Beth. And then they did develop a new QAP, a quality assurance plan, which was really important to them. And it's a rather large, robust document. And they continue to offer free water quality testing and funding. So their arsenic and uranium program, now they're into manganese. And then there's also some funding set aside for water quality treatment stuff. So like an RO unit or something if someone needs it. So they're constantly speaking with well owners, individual well owners, and working with them through those things. And then we're having a well and septic workshop next month. So we're partnering with the Water Quality District on that. We're going to hopefully get initiation of our inventory and building that framework out for that. In relation to climate change, we really haven't gotten to address a lot of it. However, we continue during wildfire season, especially. Our education is going to be things like how to create a clean room for yourself, how to find an air purifier. We would love to find funding for air purifiers to either rent or give to people who need it, or a loan program kind of a deal. Still looking for that money. So there's my plug if anyone finds anything. Mm-hmm. But for right now, it'll be how to create those clean spaces. And then the Water Quality District is continuing to further growth and development sampling program, and just keep doing outreach. So for the Water Quality District, macroinvertebrates, the Watershed Festival is going to be in August, and their water conservation campaign during the irrigation season. Oh, we do have a lot. Oh yeah, I think health and equity and that.
Yes, yeah, these are, it looks like these are both related to public health emergency preparedness and getting out and helping communities understand where the vulnerabilities are in their neighborhoods and how they can address those vulnerabilities and help those with special needs at a neighborhood level. So that's the approach we're going to take. And what we'll be looking to do in this next year is how can neighborhoods help each other? And that's essentially the QI project that we're looking at doing. Our quality improvement is around special needs and our emergency planning.
And then in terms of health equity, our septic inventory is intended to address areas most in need for connection. So we have a lot of those outlying areas that we have trailer courts and things that are just outside the city limits, that they would benefit so much more, be so much more cost effective for them and better in the long run and sustainable to be connected to a municipal system. And then we're offering free water quality testing and sampling for people. So.
All right, we'll move into our final initiative, which is number 5, all about public health infrastructure. It's our most glamorous initiative within the strategic plan. So in this initiative, we're talking about sustaining our staff capacity, having an organizational structure that makes sense for the operations that we have here at the department, positively shifting public perception about public health. So you'll hear a lot about community communications that we've been doing out to the broader community, and then also a lot of our data capacity building that we're doing. And unfortunately, you get me in most of the updates. This first one is really representative of some professional development that's been happening. It's mostly our home visiting staff that have taken advantage of some really great trainings. Mary, did you want to speak to that?
Yeah, that's a little outdated, actually. They went to those more than a year ago, I think now. Maybe it was.
Oh, it was in this last year. Sure was.
Wow.
Yeah, I know.
Anyway, yeah,
It's
so
been a long year.
had an opportunity to go to some national conferences, which is unusual for us. And with grant funding, it's hard to have funding to do that. So we had some extra funding and we're able to send myself and Katie went to the Parents as Teachers international conference, and then the Global Exchange Conference was a mental health conference that Katie and Marissa were able to go to. The Lifesavers is about, it had to do with car seat safety. And so they were able to attend that as well, which was exciting.
Professional development is really important in public health because it shifts and moves, and we have to stay on top of what's innovative in public health. And so making sure our staff have opportunities to learn is really important. And this is just a smattering. Our professional development is happening across the department, whether it's going to our annual public health conference or some other professional development that might just be online. But when we have funds, we make sure that staff have opportunity to learn. Our monthly communication campaigns feature public health programs each month. The intention behind this was really to try to help the people in the community understand who public health is, what we do, and why the work we do is so important. And our communication, Amber, has used many different channels to get the information out to the public. Get to know your public health department was another campaign. That campaign highlighted specific staff within the department. So it was really trying to put a face to our work and a face to the department, and try to make it more personal for people who may never have known that the health department even existed until COVID hit us. And so really just trying to make that a positive connection out to the community. Hosted the Invisible Shield. We facilitated a conversation up in Augusta. Last year, our nurse that had been up in Augusta providing service for 40 years retired, and that left that community without access to a public health nurse. And so we went up and facilitated a conversation with them about what it is that they need and how we can meet those needs kind of in a different way, since we weren't able to rehire a specific nurse dedicated to that community. And we have been going up to Lincoln and Augusta every month and providing information about public health services. And then we completed our data inventory, or not our inventory, but we completed our door-to-door survey, the Casper survey last summer, which then became part of our overall community health assessment at the end of in December of 2024. Our data portal is in the works of being completely transformed. And so you have seen various iterations of the way we put data out to the public. Valerie is our epidemiologist and is working diligently to try to get data out to just inform people within our community in a way that is understandable. Data can be very complex, and she's putting it out in a way that's just easily understood, in a way that people in our community can use it to make personal decisions about their activities. And right now that data portal is focused on measles because that's our recent communicable disease outbreak of concern. Our air quality data is out there so that folks can see what's happening with our air quality on a regular basis. We're concerned in the wintertime during inversions with air quality. We're concerned in the summer during fire season. So that information is out there for the public. And then our community health assessment is there. And I'm going to pause and ask if Sandy would please stop sharing this for just a second and then start sharing. I have the data portal up, and I just wanted to show you because I'm so proud of the work so if you share again, it should be a window that is up and maybe not, maybe I closed it.
Is it an edge?
No, that's okay. It was just online, but I don't see those options it's just in Edge is where it is.
Do you need to?
That's okay.
Okay.
On our website, though, if you go to data dashboard, you can see the really great work that Val has put into updating our data portal, and she's going to continue to do that. We've done some internal work around our employee orientation checklist because we want to, not only do we want to recruit great people, but we want to retain them. And the way we orient our new staff matters. And so we've done some work around improving the way we orient new staff into the department. We do an employee satisfaction survey every year, and our labor management committee builds an action plan on how we can make some improvements to ensure that staff are satisfied with the work, their work environment, essentially. We updated our organizational structure. I have our new org chart is right here in front of me. I'll pass it around for those that are in the room, and then certainly we'll share it with those online another time. But we moved to a structure where we have an operations manager, as opposed to 2 years ago we had 3 administrators. We had an administrator for community health promotion, and under that we had supervisors and programs. We had disease control and prevention, and under that division we had a couple of programs with supervisors, and then we had an environmental health division with a couple of programs and supervisors. And we have morphed over time. We consolidated 3 to 2 divisions last year when we had a retirement, and then we had another retirement this year. And it gave us an opportunity to rethink our organization. And now we are in a structure where we have an operations manager who will supervise all 7 of our program supervisors. And then we're adding a grant specialist to the team to help us with all of the grant management and grant writing that we need to be doing as a department. So that organizational structure is in official effect next Tuesday when our new staff person is showing up. So that happened this year. And then some of our advocacy work. So specific to licensed establishment, let's celebrate that the governor signed the bill that allowed us to update those fees associated with licensed establishment. Senate Bill 458 is a program that is authorized now. So what happened was that the legislators gave local jurisdictions, so cities and counties, the ability to create these resiliency improvement projects. And so and I'll use the city of Helena as an example, if the city of Helena chose to build some kind of a resiliency improvement program, then commercial properties could apply for funding to do these resilience improvements to their properties. A lot of those projects would be like energy efficiency. But one of the allowable projects could be safe firearm storage. And why we care about that is because that is a suicide prevention best practice. And so in the community, if there is a commercial property that's willing to add a firearm safe storage so that people who are maybe struggling with a behavioral health crisis has a place to take their firearm and have it be stored safely, the more opportunities we have in our community, the better likely we are to prevent suicide. And so that bill allows for that to happen. It's a little bit of a stretch to the work that we do, but specifically to the firearm storage. And then the last one is Senate Bill 95, and essentially it gives specific types of funding for the Montana Warrior Forward, which is suicide prevention work specific to service members, veterans, and their families. Is there anything else? Okay. All right, so in the next 6 months, Valerie will continue to work on building out the data portal. She'll be adding communicable disease tracking and wastewater surveillance data to that portal, and then also the behavioral health data you'll see come this next year. And I will just point to the Invisible Shield documentary as an effort to build health equity in this initiative. And that is the end of our update to our strategic plan for year 2 of 3. Thank you.
A lot of work, yeah.
Just a little bit of
presentation and the actual work.
It's a mouthful, but
Yeah.
it's important that the board understands the work that's happening. That strategic plan was built 2 years ago, and there has been an enormous amount of work, and it's important that you hear from the staff who's actually leading that work. So I'm glad that Beth and Marion, Julie were able to join. Unfortunately, the other supervisors can't be here to take credit, but I give them credit. Shelley and all of the work in immunizations, Jennifer's, she wasn't able to be here either in water quality. Nina in licensed establishment. We just have great staff doing really hard work. And so there's some highlights for you.
Great, thank you. Any questions? Okay. Announcements. So we've got a couple. I think we heard about Superman tonight. I don't know if you want to add anything to that. That's 5:30 down on the walking
Mall,
right?
the 10 mile area, the 10 mile brewing area.
Great, thank you. And then for the boards, it's that time of year to do Drenda's appraisal. So there will be an email coming out this coming month. So please take the time to evaluate and appraise and provide feedback for Drenda. So expect those, and then that'll you guys will go over that in June, I believe, right?
Yep.
Next meeting.
Yeah, and for new board members, the board does supervise me directly and do my annual evaluation. And so those that have been around, you're old hat to the process, you'll get an email, you'll have an opportunity. I guess the message that I want to send is I really need your feedback. You are who really does direct the work of the health department, and I'm open to feedback, and I use that feedback to do better. I know that I am not a perfect director of public health. We try really hard to do our very best here, and I look forward to hearing from the board on ways in which I can do my job better. So I really do look forward to that feedback every year. So please don't hold back. I appreciate the feedback. And then the only other announcement, and it really isn't an announcement, I just wanted to point out in your packet, there is a full and robust legislative update in there for you.
Thank you.
And in just a 60-second overview, the highlights are the licensed establishment fee increase bill passed. Yay. That was a huge win. The Medicaid expansion, that bill passed. that was a huge win. It passed with, it no longer has a sunset, so it will live in perpetuity as long as federal funds come to the state of Montana to support Medicaid. Montana's Medicaid expansion program exists. So that was a huge win. There was a lot of great work around immunizations this time around. Some good things and then some bad bills that we were able to stop when I say we, I mean, it was the public health community. We have a state association that does an enormous amount of advocacy work and lobbying during the session. And there was some bills, immunization bills that we tackled. There was a ton of land use bills that Beth participated in providing comments so legislators could really understand what's happening at the local level and how those bills impacted the important work that happens in public health around environmental. There was some tobacco bills that got killed, so those were good news. There was another attempt at creating cigar bars that got stopped. So that's good news. So I think overall it was a decent session. There was not a whole lot that negatively impacted public health that came out of the session. So but that report is as thorough and robust as it comes. So if you're interested in the intricate details of the work that our state public health association did during the course of the session, that report gives that to you.
Had a great conversation with folks from some of the folks from NAMI, and they said that it was one of the best sessions for NAMI that they'd had in a long time.
Yeah, the Department of Public Health and Human Service budget was increased, which typically never happens. And the increase was really primarily behavioral health services. So that was another excellent highlight that came out of the session.
Yep.
So we should see some pretty great things happen with local services in behavioral health because of that.
Do we have any public comment?
We do not.
Well, not seeing or hearing any. I just want to take a quick second. This is my last meeting. I'm skipping out next month. So I wanted to say thank you to the board members for dedicating all your time to support the health department. And then as someone who's been in primary care, by definition, we're supposed to come first, but that can't be done at all without all the work you guys do, clean air, clean water, taking care of our vulnerable populations, babies, mental health. So you guys do so much work that so many within our community are not aware of, that I just want to say it is truly appreciated, all the work that everybody does. So thank you.
Yeah.
I appreciate
Our job is to keep people out of the hospital.
it. Is. Yep. And it all starts with you, I'm sure. So thank you.
Yep.
Yeah.
Thanks, Dr. Bedell. We're going to miss you on the board. Between now and the July meeting, the county commission will be selecting the 2 new board members. The position that you hold is a practicing physician in Lewis and Clark County, and then Bree's position, which is a consumer of public health or of health services in the county, which is pretty broad.
Yeah.
So those are the 2 positions that will be filled sometime between now and July. And we really appreciate all of your dedicated commitment for 6 years.
Yeah.
You were here and you worked hard with us, so thank you.
My pleasure. Thank you. With that, we're adjourned.
Thank you for all the time you put in.